on high blood pressure. And that was very, very important to know that when you are younger, your body is everything's perfect, everything's doing well. But over the years that we accumulate, whatever we eat, whatever our body is not doing correctly, to break down the fat, and that's when the inflammation in the blood vessels, it's the way how the body is trying to repair the damage to the lining of the blood vessels. So what the body does is when there's the inflammation, the body uses the LDL, the low density cholesterol, to patch it up. So they will attach to the blood vessels inside the wall, and then it starts to build up a protective layer to prevent leaking from the blood vessels. So over time, that build up inside, it actually builds up thicker and thicker and thicker. So the blood vessel in the wall become thinner and thinner and thinner. So when the blood vessel becomes thicker, the elasticity become weaker. So they don't expand anymore. Like when your heart pump the blood, it will expand, let the blood go through. Now when the blood vessel gets thicker and it gets hardened, it doesn't do the same anymore with each pump, and then it gets thicker, and so it restricts the blood flow, and the body has to use the adrenaline. So it's adrenaline that's being produced to send the signal to push more blood or stronger. So that's how our blood pressure goes up, and also stress. So all of that works together to push the blood flow a little faster and better, or then to supply the body what the body needs. At the same time, when you get older, your liver gets more saturated with the cholesterol, with fatty stuff. That's why we have fatty liver. And then the more you do that, the more the less functional the liver becomes. So it doesn't help the body to regulate sugar and regulate blood as well as before. So pressure goes up. So what the Fund of Life does is it helps to reduce the inflammation in the blood vessels. So that helps to clear up the LDL buildup inside the blood vessels. And it also helps to clean our liver. It helps our liver to break down the fatty stuff in our liver. So it helps to reduce the readings of fatty liver. Some people, they lower the fatty liver reading from 128 to about 14 or 17, which is the normal range. So when that happens, your body is now able to use the liver as a reservoir to kind of regulate in our body. So imagine the Chinese Three Gorges Dam reservoir. When there is a flooding, it'll hold as much water as you come. And then when the lower stream becomes safe, it'll open a certain gate. They have controlled gates that you open just enough to let the downstream to use it to irrigate their lands. Like when they need it, you send as much as they need, but you don't want to flood everything like without this control. So the liver does that for us, for our blood pressure, for our cholesterol, for sugar, for almost everything else as well in that respect. So if you allow the body to do the job, then they will do it for us. So the Fund of Life would help you to get rid of this inflammation, help the liver to cleanse, and to regulate your blood pressure, your sugar in the right way. So if you have low sugar, it will help you to raise up. If you have a skinny body, you get your body in a better weight range to help you cope with the cold and stuff. So that's how our body benefits from this high blood pressure by using the Fund of Life.
Jose, want to say something? You can open the microphone.
I have a question here in the Q&A. Patrick. Oh, Patrick is online. Henry, one of my friends is concerned that FO has high potassium he is concerned that some patients may not be able to handle too much potassium. Yes, when you see the reading on that label, people get scared of the potassium, and we actually had great results with the people who have kidney issues, have problems that it's the potassium in the function of life is not a problem according to our clinical tests and everything. It's not the potassium that people are worried about. It's the lignans. It's the lignans. I think there was some David explained that. I couldn't remember all he said. So it's something that doesn't need to be worried about. If people are, let's say, they are afraid of too high level of potassium in the body, this is not going to contribute more. It's this is the lignans that people use. It's in that name, but it doesn't contain a lot of potassium in there. Okay, so we just crossed the 10 o'clock mark, our 1 hour timeline. So we are going to, if you don't have very much more to talk about, we're going to stop here. And I welcome everybody to get on the line and then join our meeting tonight. Thank you very much. Anybody has any last word to say, or? Thank you, Sarah, for getting on the call. Thank you. And thank you, Pat. Thank you, Sharon. Sharon from Jamaica, right? And Prince Celestine from St. Vincent. We are a multinational community here. Thank you. Thank you, everybody. We'll see you, Wayne and Larry. I know you're coming from London. We'll see you soon in September, if not before that. Thank you. Have a great night. Thank you.
Thank you.
Thank you, Henry.
Okay, good night.
Night.
To the meeting. Okay, bye.
Thank you.